I'm pretty sure you had a lot of like couples that comes to you for advice. How do you guide them?
Okay, well, number one, I always tell them that morality is a primary factor, because with morality, you as an individual would know what is right and what is wrong, right? Now, in terms of intimacy, is that what you're asking me? Well, of course, number one is proper hygiene all the time, right? And number two, I think what is also very important is respect to one another.
Hello, Amigas. Welcome to our second episode of Amigas Podcast here at the home of Amigas Podcast for this season, Kenneth Cobonpue showroom at the heart of BGC. I'm so excited because, of course, we had such an amazing talk last week, during the Valentine's special, but today we're going to be tackling some subject that it should be in everybody's table, but somehow it's not. We're taught how to be desirable before we even taught how to desire. And we are taught how to be careful before we're taught even how to be curious. And somewhere between being a good girl and a confident woman, many of us learned that wanting more was something to apologize for. This episode isn't about being provocative. It's about being honest. About the shame we inherit, the silence we master, and the questions we were never allowed to ask out loud. Because when women talk openly about sexuality, it makes people uncomfortable. Not because it's inappropriate, but because it's very powerful. Well, today I want to introduce someone very special that will unpack the taboos around women's sexuality, where they come from, how they shape us, and what it actually takes to unlearn them in modern times. This isn't about pleasing anyone, it's about finally telling the truth. And to help us unpack this, we are joined today by Dr. Jenny Jose, who is the president of Aesthetic Gynecologic Society of the Philippines, graduate of European Society of Sexual Medicine, chairperson, Philippine Board of Gynecology Robotic Surgery. Dr. Jenny, welcome to Amigas Podcast.
Thank you very much for this invitation. I hope we're going to all enjoy this talk, right?
I'm sure I will. Well, Dr. Jenny, it was such a pleasure to meet you back then, like last year, when you attended the event.
Yes.
Right? And then I was so amazed. You explaining to me what your specialization actually is.
Actually, we did talk a lot about this during that time.
Yes, and that's how the idea came up in my mind to actually invite Dr. Jenny to go to be a guest in our podcast to talk about a very, very sensitive topic. That's supposed actually to be, by this time, this modern era, normal in anybody's table, right, Dr.
Yes,
Jenny?
actually, it's very, very common and very normal, because nowadays the people whom I see in the clinic, they're very, very outspoken now. I mean, compared to before.
Yeah, that's amazing. But do you feel, doctor, that there is still a lot of taboo around women's sexuality?
Yes, there is a lot of taboo, because remember, like here in the Philippines, this is actually a very Catholic country. So we are brought up very differently from the Western world, right? So of course the influence of religion, our culture, molds us to be like this. But everything is getting to be modernized now, so there are a lot of changes that are happening, and people are actually getting to be well informed, which is very good.
So Dr. Jenny, during my time, that was not a long time ago,
right?
There's a lot of expectations about behavior of women in general,
right?
And I do remember my mom telling me that it was expected of me to marry virgin.
Yes. Actually, when you say you have to marry a virgin, of course, that is like based on our religion, what the society dictates, right? And, it's like telling young girls that, you have to be pure when you get married, right? But come to think of it, now it's actually changing. It actually, when you say that you have to get married and be a virgin, when you get married, it's like saying that you have to be like this. It actually encloses you and restricts you, right? That's how you feel.
Yeah, there is a lot of pressure. Not that I'm complaining, but I mean, there is a lot of expectations. And I don't actually remember of anybody or even in school because like I have a daughter.
Okay.
She's a teenager. And I was honestly shocked when she was, I think, not even 10 years old, and there is already, one of the subjects was about,
Sexual education.
Yes, sexual education. And then I'm like, wow, aren't they too young for that?
Yes, actually, the truth is we should all learn from that, right? So young girls, like especially during the high school times, or maybe grade 6 or grade 7, you have to be familiar with your body. Because like majority of the patients I see, let's say 40 and above, I tell you, they're not familiar with their genitals.
Oh, wow.
So it's really good that, the young girls now know about their body. They should be familiar with their genitals. And then, of course, a sexuality should also be taught to them.
But in a would say like in a scientific way, right?
Yes, definitely in a
so
scientific way.
So we need to be very careful about how it's explained to kids.
Yes. But I think it's okay because it's anatomy. It's like just telling them, okay, you have your arms, you have your hands, you have 5 fingers and 5 toes. It's just telling them, okay, these are also part of your body and you have to know about it.
I remember also, Dr. Jenny, that when I had my first period, I was so ashamed. I was hiding myself, and it was awful because I was traveling with my dad.
Right.
And then suddenly I got it. And I was like, oh, my mom is not around. What am I going to do? So I was so embarrassed. And then I went to my dad and I was like, Dad, I said, why? What's wrong? I'm bleeding. Oh, okay. Do you need a tampon? Do you need my dad was so cool. And I'm like, wow. But I guess it's just like because the expectations and
what was talked
about, right? So nowadays, is there still like a lot of taboo about menstruation?
Definitely, because a lot of people are saying when you menstruate, especially the young girls, it's actually dirty, right? So, it's really good if we have like sexual education and also to tell the girls while they're growing up that this is the reproductive system. As a child, you know that puberty, you're going to develop your menses, you're going to have like the reproductive cycle going on. So because of this, you have to know about your body and then you can have better decision makings in life.
Does make sense.
It makes sense, right?
I wouldn't feel so ashamed if I knew more.
Yes, if we're familiar that it's going to happen, I'm sure you're not going to be frantic and scared.
I did have friends that they were like crying. Oh, what's happening with me? And I'm like, Fran, you have your period.
Right, right.
Actually, most of the times, not knowing is actually a sin, right? Ignorance is a sin.
We have to know, right? Because so that we will have control of our body in different situations as well.
And I do remember also, Dr. Jenny, there is a lot of comparison, like growing up expectations. You need to be a good girl.
Okay.
You need to be a good girl.
Yes, yes.
And for me, that was a little bit frustrating, and I was pressured because I wanted to be a good girl.
Can you define me what is a good girl in your mind?
Like, I remember growing up. Today it's very different.
Okay.
I'm no longer a girl. I'm a woman.
Okay.
Just want to announce to everyone out there, I'm a woman.
You matured.
I'm matured. But I remember that there is certain manners that were expected for me. Behavior.
Okay.
And even when it comes to knowledge, like the less I know, the better.
Okay, the less you know, the better.
Yeah, like the innocence, of the matter.
Yes.
Like it would make me more attractive.
Okay.
Or more desirable.
Okay.
Or more precious.
Okay. In the society, it's actually very different because if I tell you, okay, you are a good girl, you're actually very restrictive with your thoughts, with your feelings, and how you act.
That's
right?
actually how I feel.
Yes, but you see, the society dictates that, and that is the norm, and that is what should be girls are growing up with, right? But how about being a bad girl? Like, what is a bad girl for you?
Okay, let's say that bad girl. I wouldn't say bad girl, but I do remember that there is a lot of gossiping, going around. That the girls that were more upfront, straightforward, they knew who they want to date. They know exactly what they want.
So they're more mature? They're more forward.
They're more forward.
Yeah.
And they're a little bit intimidating.
Okay.
They were the bad girls.
Okay.
And then sometimes the man or the boss, they would be attracted to the bad girls. But it was told to us that if you're a bad girl, you're not good for marriage.
But do you know that when you coin the bad girl word, it's like saying that in the society's point of view, these women are the ones who are actually enjoying and experiencing life, isn't it? There is no restrictions.
Well, today I rather call them experienced women.
Experienced women. Right.
Mature women. But is it today still part of society? Those kind of, complex, like bad girl versus good girl, what is expecting, what is somehow like, banned
the
or
society
not
has
accepted.
actually evolved, right? Like even here in the Philippines, because we are very religious, we're very conservative in this country, but there are a lot of changes on how women think about life already and how to deal with human sexuality. I've actually trained in Hungary, and I was meddling with different doctors and also psychologists from different parts of the world, and I'm so surprised because they are in a different level already. So I think everything is part of maturing, or the society matures and everybody's actually growing up, right?
Dr. Jenny, is it still today something like happening when it comes to double standards? Because
Right.
I must admit that even myself at the age of 42, I do experience a lot of double standards of
Okay.
people that I know, that I'm connected to. They expect me to behave in a certain way,
Yes.
but they don't do the same because they're male figure.
Oh, okay.
And I know that's very common back then.
Yes,
because I grew up seeing that.
Right.
But what about today? How do you deal with that?
How do you deal with double standards?
Yes.
Well, you know what? Each and everyone, they can actually express themselves the way they were brought up, right? But of course, the society dictates that we have to take note of the norm of the society, what is the effect of religion and culture to each and every individual, because that is the one that molds each and every one of us. So I think as long as you do good and you do not cause discomfort or problems to others, and you can actually express yourself the way you want to express yourself, I think it's still acceptable.
But how does that affect women's sexuality?
Oh, it does really affect women's sexuality, because this is what happens. What is the difference between men and women? What happens is that men are actually they're thinking that they are the best and they are the ones who control situations and also life. Women are actually very submissive, right?
Yeah.
Am I right?
Yeah.
But that is how the society dictates. But with us, I think it's very different now, because now we can see a lot of women who became leaders of different corporations, of different institutions. And because of that, there's more self-expression for women now, right?
And how much of this sexual guilt is inherited? From actually your family, your culture, or maybe your surroundings?
Yeah. Well, I've read in a lot of studies, it's around 65%.
Oh, wow.
That's quite big, right? So I know there will be a lot of modernization that is going to happen, but it would take some time, because it's not going to happen overnight, right? Because we are actually taught by our parents and also what the society dictates, which I think is very important in molding each and every individual.
And who benefits from, the fact that human sexuality is actually somehow silent?
Well, when you say that human sexuality is silent, especially for women, it's actually the males, right? Because they stay on top in the society. Women become very submissive. Women are actually going to make ways to please men. Men are actually raised that way. They have to be on top of things, and they are the one who is going to control life. And women are just going to give pleasure to men. They're actually brought up that way to, for harmony.
I remember, Dr. Jenny, growing up, that my brother would have conversations with my dad, and they were really
Regarding
talk
this?
talk about anything, about girls, about what to do, about what not to do. I never really had those conversations with my mom.
Yes.
It was not something that was acceptable. I think during the time, my mom today is very open, but during the time, if I mention something, I think she would have slapped me.
You see, that's why I tell you, it's actually very restrictive for women, right?
Yeah.
We're not supposed to talk about these things. It will actually, they say, demoralize us.
So why is it encouraging men to be curious, and when it comes to women, is actually they want to punish us?
Okay, well, for men, it's going to be like, if they're very curious, it's actually in their ego, right? It's actually pushing their character. But
He's the man.
Yeah, he's
He's
the man. Right. It's really
But
ego.
women?
No, it's going to be like very negative for women
Yes.
because, we are expecting that women are not outspoken. So we're just going to be quiet about it.
So why is it that, I remember also, like even recently, we kind of still, even in modern days, whisper things about it. We don't really say out loud. I've overheard like boys talking about,
Yeah.
I did this, I did that. Yeah, she's like this, like that. But when I'm in my circle of friends, it's like, this is what happened.
Yes.
I just got my period. Like how will society actually somehow like define or help to shape women's behavior towards their own sexuality without punishing or seeing it as dirty or not appropriated?
Yes.
Like how much can it contribute, or does we need as women actually to take charge and to educate each other so that things can change?
I think that is
what needs to happen?
Well, I think number one is education is very important. That's why I think that in grade school or in early high school, everything has to be explained to growing children, growing kids. And then number two is that, what do we have right now? We have a lot of social media. We have like books. We have like conversations like this where we can talk about and share to other, to the viewers, to the individuals, what is right and what is wrong. Because we're brought up that we're so ashamed of all these things, right?
Yes.
But actually, there's nothing wrong with it because everything is very natural.
So I need to embrace the natural.
Yes, we have
and
to
just be
embrace
proud
it.
of it. It's really
Yes.
like God's, masterpiece.
Yes.
Everything was created at its right point, right, for its right purpose. And honestly, like having a daughter, it's a little bit challenging. I may confess, Doc, that when I heard that she was have sexual education in school and she was, I think, at the age of 7 or so,
See, I told
was
you.
shocked.
You were shocked?
And I actually had a meeting with the teacher.
Oh, you mean you approach your teacher?
Yes,
Oh.
because I want to make sure what they're teaching the kids. Like, it's something that I would approve because it's something that I want to teach my kid.
Right.
The right way, the way that I think that she's supposed to be taught for the age that she had at the time. And I was very adamant in telling the teacher, I'm not comfortable with this, I'm not comfortable with that.
Well, for sure, it's going to be like anatomy, right? To tell them these are the things and everything.
No problem with the anatomy, Doc. I'm just a little bit scared that maybe the wrong connotation is being taught. That's why sometimes I myself have a little bit of difficulty in somehow assimilated the feminism.
Oh.
Because,
you have to accept it too.
I do accept feminism, Doc, but there is a very thin line about being a feminist and a liberating woman.
Okay, so what do you think is the difference then?
I think the difference between being feminist is that we still fight for our rights.
Yes.
Our right place in society, knowing our capability.
Yeah.
But we don't lose our feminine.
Okay.
Okay, like
well,
I don't want to be like a man.
Yeah.
I even if I'm strong, I go to the gym every day and I work out every day and I can lift sometimes the same that's the men are lifting. But in the end of the day, my body is really of a female.
Yeah.
So I do not expect to do certain work.
Right.
Like physical work that men would do.
That's true.
I also do not expect to pay for the bill. Because I think that's the man's job.
How about the Dutch treat, huh?
You know what I mean? So
yes.
I want to be able to gain space in society based on my merits, the things that I've accomplished, because I know I can, without competing, because I don't think men and women should compete.
Yeah, definitely not, because we're actually built up very differently. We were brought up in this world. We have different functions, right? But it has to be very complementary. But I think women should, the voices of women should actually be heard too. I mean, if the man knows about their body, I mean, in terms of biological, psychological, sociological, everything about their body, then, women should also know about it too, because there's nothing wrong with it. And I think we should not be ashamed of what we have, like having menses, taking contraceptive pills, all this. I don't think it's wrong. it's very good that we start with education again.
Education, not only the women, right?
Yeah,
also
yeah.
the men.
Of course,
because men
yes.
is, it's a constant denominator in a woman's life.
Yeah.
And if the men are aware and they know also how the body of the woman works,
Yes.
everybody benefits.
Of course, right.
When it comes to being liberating, Doc, like how can scientifically, how can you actually somehow guide, the society in going to the right direction and not mixing things up?
Okay.
Like you said, through education we can do that. Maybe through podcasts like that we can do that. But what else do you advise as a doctor? And your specialization is really like sexuality, right? Women's sexuality. I'm pretty sure you had a lot of like couples that comes to you for advice.
I know, right? Well,
how do you guide them?
Okay, well, number one, I always tell them that morality is a primary factor, because with morality, you as an individual would know what is right and what is wrong, right? Now, in terms of intimacy, is that what you're asking me? Well, of course, number one is proper hygiene all the time, right? And number two, I think what is also very important is respect to one another. And at the same time, intimacy is very, very important. And, for you to grow your relationship and be in that situation, you have to make an effort to keep that intimacy. And how do you do that? Well, of course, for women, you always have to be confident and pleasing to your husband. The men, it's very different, because women are more on the emotional factor, right? Like, for instance, before they get into having intercourse or sex, they have to be emotionally involved, right?
Yeah.
But for men, it's different, right? Sometimes it's like biological that they need to release their sperm. So I think what is very important is both the man and the woman should talk about it and should work together to achieve the goal, so that, let's say, their partnership or their marriage will actually stay.
Doc, so in short, it's really about relationships,
right?
Closeness.
Yes.
And you cannot have that with multiple partners.
Oh, no. It's not going to be like, we're not going to be happy with that, right?
So actually, being sexually aware does not mean that you're liberated.
No,
right?
No.
Or that you need to sexualize yourself on social media.
That's why we have to educate very well, right? Yes.
Because it's very like nowadays, I really come across, I wear very sexy clothes. I'm a Latina. Okay?
Okay.
So it's not that necessarily I want to call attention that way. It's just part of my culture, and that's how I feel good. So because I dress up for myself.
Yes.
But I do come across, like, if I go to a beach, of course I'm going to be in a bikini.
Right.
And then I'm going to have a bikini photo.
Yeah.
Right? And then some people may be shocked that at my age I can afford to have a bikini photo. But some people will enjoy it.
Yes,
Because social media is all about, everybody checking their phones, check each other's photos.
Right.
But I do see, doctor, that somehow there is a very dangerous assimilation with, being sexually aware and, actually sexualizing women online.
Right. That's true. That's why we really have to be guided, right? Because, in social media is actually very powerful. And, we cannot change that anymore, because we know everybody's on the internet. You don't open books anymore. So I think, what do you think? Do you think that to regulate what is in the social media is also very important?
I think different social media apps or venues, I think they should actually somehow control.
Yes.
Then maybe there is really a need. And I'm actually happy some of them have been controlling a lot of things.
Oh, that's good.
Like I have come across, Doc, like some very uncomfortable messages. And I actually found a tool in my Instagram account where I can block. Because before I would like open some messages and I see pictures. No, I just open them and then suddenly there is a video, a picture that's inappropriate, and I'm like,
okay.
But now there is actually some tools out there that you can block anything that so you don't want to be shocked when you open your DMs. But I mean, generally speaking, I think it should be controlled.
It should be controlled.
It should be monitored.
Yes.
And it should also somehow educate people to use it in the right way.
But I like what you said about self-expression, like, like we are in a very conservative country. I know you did not grow up here, right?
No, I did not grow up here.
But of course, it's very different, I'm sure, compared to Filipino culture, right?
Yes.
But what I like with what she said is you express yourself, right? And there's nothing wrong with it.
Thank you, Doc. I also think there's nothing wrong. That's part of my personality. Sometimes I'm misjudged. Sometimes I'm admired. In the end of the day, I think if you know your heart, what is the reason why you do what you do, you cannot go wrong.
Yeah, so like for instance, like what you said about wearing bikini, there's
even
nothing
the beach.
wrong with it. Right?
I cannot wear a dress covering from up to down.
Right?
I will wear a bikini if I can afford to wear a bikini.
And there is nothing wrong with that. And it's okay to develop your confidence in doing so, right?
Yeah, which sometimes, it makes me question, Doc, when it comes to all this women empowerment, if there is really like empowerment when it comes to self-expression, it actually is just a myth. It's just like some people just want a validation.
Yes, right.
So do you think that all that women empowerment, claim your sexuality, being more aware, being more outspoken is really happening?
It's really happening right now. I'm so surprised. Like even in the clinic, the young patients that I see are actually very straightforward. Like for instance, I don't know if you're familiar with vaginismus or vaginal tightening during intercourse. Before, even during residency here in the Philippines, I don't see cases because people are quiet about it, right? And so what happens to marriages? They just like, okay, tomorrow they're not married anymore because they cannot consummate marriage. But now I'm seeing, let's say, 3 or 4 cases in a week. That's actually a lot.
So that's their concern.
Yeah, because
inquiry.
That's for intimacy. And they come and, I don't need to ask these questions anymore. They present themselves. I have this problem. I want to have intimacy. I want to save the marriage of my marriage. And then, can you help me with this? So, it's okay to be upfront with what you like. You empowered yourself to be confident in saying what you need. And I really say this in the clinic right now.
May I ask, what are the average age of these women?
Oh my gosh. Well, 20s to 40s, because normally that's the time that they get married. Like you were asking me earlier that you have to get married a virgin, right?
Yeah.
So I could still see a lot of women getting married and they're still virgins, which is good. But then to stay virgin forever, and you're married, I don't think it's right? It's good if the husband will not leave her, right? So, yeah.
Doc, do you encounter some patients or even some husbands that actually have complaints about the age of their wives, or is there expiration for women? Because in society sometimes women is treated from this age to this age you're good for this, and then you go up to this age you're good for this, and then after that no, you're just a Lola, you stay home, you should not have sexual life, no relationship, retire girl.
This is what I would share with you, because now I'm seeing perimenopausal to menopausal women who wants to equip themselves. Okay, that's why they go to me as a gynecologist, because number one, they want to be lubricated still, they want to have intimacy, they still want to have orgasm, they want to be loved by their partner. So they come with these concerns, and it's good because they know what is missing in their body and they want to be treated, right? Just in terms of improvement in the quality of life. So yes, a lot.
So you have solutions for these women?
I have a lot of solutions for these women, because I deal with those kinds of the age group, because I'm a urogynecologist. So I deal with this a lot of things with this.
So there is a lot of women that come that they still want to be sexually active and enjoy with their partner, and then you can address all those concerns.
That's true. I don't know if I'm going to share this, but I see a lot of, let's say, CEOs of different companies, and they're single, or they have divorced, or they're separated, and then they come to me to be fixed, so that when they go to conventions outside of the country and when they meet somebody, just imagine this, okay, then they are actually equipped and ready to have intimacy. So I've been seeing a lot of these women right now, which I think it's good because it empowers them.
Yeah, that's amazing. I think that it always starts in the head, right?
Yeah. Mm-hmm.
What you think is what you become.
Yes, that's true.
Right?
Yeah.
And then when you think of yourself of a less of a person, or you're not deserving, when
Right.
your self-confidence is so low, there is no way that you're going to thrive.
Right.
In any
That's
area
true.
of your life. And when it comes to sexuality, it works the same way. Do you have like advice, doctor, for women that still, because I think it's hard when you upbringing teach you, like there's a blueprint, right?
Yes.
And then it's kind of hard to rewire yourself to
Right.
become who you need to become.
Yes.
In order to actually be fulfilled, content, and happy.
Yes.
Do you have like a, advice for those women that still struggle with the modernization of being more open about their sexuality and actually claiming their sexuality and being confident about themselves? Do
Okay.
you have like advice for them?
Yes. Well, this is how I see a lot of Filipinos. In terms of sexuality, they really don't think about it until the time that they become sexually active, right?
Okay.
So I think what would be good right now is that, with all the modernization, is you really have to educate yourself. If you encounter any problems, then you seek consultation with your doctor, with your gynecologist, because definitely we can help you. There's so many things that we can offer so that your confidence will improve. If you have problems in terms of the anatomy, we can also address that too. And even your hormones, we can address that too and improve your confidence.
So hormone therapy is actually available out there,
Yes,
right?
yes.
Because do women also suffer from, right, like lack of libido as they age?
That's true, yes. And we have a lot of things that we can offer now, especially when we improve the libido. Like we have oxytocin, we have different creams that we apply, not only for hormones. Like in my clinic, I have different lasers for vaginal rejuvenation, which improves the blood supply, improves the nerve supply.
Interesting.
improves
Keep
the
talking,
collagen.
Doc.
There's so many things that we can offer. Like we also have like biologicals and like PRP. Have you heard of this? And
Yeah, but not
exosome.
down there.
Yes, because remember, this is phase number 1. Down there is phase number 2,
Oh my
right?
God,
So
I
you can
love that.
actually not only like enhance yourself, but also you can enhance yourself down there too.
So that your confidence will be boosted.
Yes, and then you can enjoy life more.
Amazing, dog. That's so enlightening.
Yeah, there's so much things to offer right now, which is
pain
good.
free, dog.
No, it's not painful.
Not at all.
Not at all, right?
Oh my God.
So we have different ways of addressing these problems, not only with hormones, but you see, it has to start with the person first. I want to address my concern in terms of sexuality, and then once they know that and accepted that they have to be improved in that area, then of course you can address. Just imagine those who had cancer or even radiation therapy in the reproductive system, and then they become dry, right? And then they still would like to embrace sexuality. And let's say we cannot offer, let's say, hormones to them because of their cancer problem, then, we can offer different kinds of ways to address dryness, irritation, recurrent UTI, like, incontinence, which is actually very common in this age group of perimenopause to menopause, right?
Oh, wow. So we need to take care of the phase number 1, the body, the phase number 2.
Yes, right?
I'll add that onto my list.
Isn't it? Then you will develop more confidence, right?
That's true.
Yeah.
That's true. Confidence is a huge player when it comes to intimacy.
Right,
The more confident you are, the better you perform.
Yes.
The better you allow yourself, like the more you allow yourself to actually, enjoy.
Yes.
And be happy.
That's true. And actually, like if you're gonna ask me why did I study aesthetic gynecology, I do a lot of robotic surgery, and my patients say, "Oh, you made me pretty up here. I just have a small incision. You removed my uterus. Why don't you make me pretty down there?" So they're actually the
point.
ones who pushed me to study
Wow.
aesthetic gynecology.
Amazing. Doc, now for those patients or women that actually have a hard time, talking about it, open themselves up, even to the doctor, is there like a support group? Or do you advise them to talk to friends? How does it work?
Well, we don't have a lot of support groups in the Philippines compared to, let's say, in Canada. All the support groups are there, right? Here in the Philippines, it's nice to talk with your peers, to your friends first, and then you help each other and encourage each other to seek consultation. Because why waste life? Like, for instance, I saw this couple, they never had intercourse for 8 long years, right? And they just discussed it after 8 years. Come, let's go and see a doctor. So after, let's say, seeing me, they're okay and they're just so happy. So, it's good to open up because there's so many things happening and new things, like new modern things and treatment in the world right now, which can actually improve our quality of life.
So that's how, like, you unlearn shame.
Yes.
You need to be open about it.
You have to be open about it.
And start
right?
a conversation.
Because there's nothing really wrong with it.
Yes. Now, what about mothers and daughters, doctor? In your professional advice, how do we actually, and when is the ideal age to start that kind of conversation, to educate our children?
Well, I think the mothers right now should teach, like what you said earlier, you have to be a part in teaching sex education, with your children. I think that is actually very important because if that happens, the apprehensions, right, it's not gonna be there anymore, and you will be feeling very comfortable talking about this with your daughter. And because of that, you'll be very much open, and it will be very good because then you know that your daughter will not be rebellious in the future because your daughter knows that what you're teaching is real and true and it's for their own safety, right?
Yeah, so being honest.
Honest.
Building a relationship, a trust, like relationship with trust. That's probably the key.
I think it's the best if you start sex education at home. Right?
Yeah, exactly.
So nobody's
better you start instead of somebody else, because like me, I wanted to control what gets to her.
you even did go to the
I talked to
teacher,
the teacher,
right? Yeah,
I did, because I'm not there. I don't know where it's being taught.
But did you negate your teacher? No,
I did not.
Not okay.
But I made her a little scared.
Okay.
Right. After talking all about that, and having to face, so many taboos. Enlighten us. What would you say that a healthy sexuality looks like beyond the youth, the teenness, and approval?
Healthy sexuality?
Yes.
Well, beyond.
The way you look, like the teenness, the approval of others, about how young you are. How does it look?
How does it look like?
Yes.
Well, number one is, I think you have to develop confidence in yourself. In any age group, in the reproductive age group. So, let's say when you're in your teenage years, of course, you have to be, let's say, guided by your mother as much as possible, and also by school, of course, your teacher. And then you have to know about menstruation, so you don't get scared. You should know that it is very normal. You have to know the different things like use of oral contraceptive pills and all this. And then once you reach the reproductive age group, of course, the hygiene, how to take care of your pelvic floor. And then after, when you reach the perimenopausal and menopausal age group, where you feel all the different kinds of symptoms like dryness, irritability, hot flushes, all this can actually be addressed too. So, what is the bottom line of this? It's actually education, right?
So, sexuality is not an act of rebellion.
No. It's actually knowing
it's
about
self-love.
yourself. It's self-love. You take care of yourself. And then when you reach menopause and you don't have hormones, then you can actually deal with all your concerns in terms of perimenopausal and menopausal. So it's like saying that it's really good that if you start young, because you know what to expect, and at the same time you can address it properly. Right?
So it's all about, it boils down to education.
Yes, education.
It's from home, from the school. Now, if you could pick one lie that was about female sexuality that needs to die today, what lie would be?
With female sexuality? Well, that I don't know if I can say it straight, but I think you should not consider sex as a taboo. Right? Because there's so much more into it. Life starts with intercourse too, right?
Yes.
But you have to be guided by your family and of course your culture and the different norms on how to be in that situation, right? And yes, I think that is very important because a lot of young girls are thinking that way, that it's taboo. That's why, there are abortions and all these things that we'd like to, dispel. So, yeah.
That's very difficult, no?
Yeah.
If what actually initiates life is actually being somehow blamed or shamed.
Yes, shamed, right.
So how to get rid of the shame? Is it like embracing yourself to its full, extension?
Yes, I think you should
Be
embrace
proud?
it. Embrace it, treat it as normal, okay? Understand your body as well, the reproductive system, and also, the changes that happens to you from childhood to menopause, and then at the same time, be your best self. I think that's it. You have to empower yourself, right?
Yes, Doc, if you'd like to give the advice to everyone out there
Okay.
that's going through something that's going through a lot of challenges from, younger years up to now, and we're not able to yet, address that shame about, claiming its sexuality or being comfortable in her own skin. What would you tell them?
Well, I would say that, sexuality is actually very normal, okay? You might not be used to it because it's not being taught at home, but it's actually very normal and there is no problem with it. You have to embrace it, okay? So that you know that when you are in that situation, you're going to be okay and you will be enjoying life. And you won't have any problems with your peers, your family, and also your society.
So thank you, Dr. Jenny.
Thank you. It was a pleasure.
It's such a wonderful conversation. I've learned a lot.
Thank
There's
you.
a lot of enlightenment, and I'm definitely doppering by the clinic.
Yes,
Okay, but thank you.
Thank you
for being so
also.
open and for, being so informational. And I really, really hope that, more women out there are able to come
Yes.
and, and then to address what they
Right.
need to address without feeling the shame.
Yes, yes.
Right?
That will happen soon. I mean, it's just very
soon.
slowly, but it's happening
It's
in the
happening
country.
already. That's
Yeah.
amazing. So if you're still unlearning shame around your body or your desire, congratulations. That means you are awake, not broken. We weren't taught to center ourselves. We're taught to be convenient. So if choosing yourself feels uncomfortable sometimes, that tracks. You don't own anyone access, explanations, or a softer version of yourself to make them comfortable. You don't have to have everything figured out. You don't have to label yourself, explain yourself, or perform confidence for anyone. Take what fell through from this conversation, leave what didn't, and give yourself permission to move at your own pace. Thanks for hanging out with us, for listening with an open mind, and for being part of a conversation that still needs to happen. Thanks, Amigas, for trusting me. Be kind to yourself, and see you again for our third episode here at Kenneth Cobonpue Showroom BGC, the home of our favorite podcast, Amigas Podcast for Season 2. Love you all, and God bless you.